Hi, my name is Ednalise Santiago, a postdoctoral fellow from the University of Puerto Rico Medical Science Campus, and today I'm going to talk briefly about this work entitled Proteomic Profile of Caribbean Hispanics with clopidogrel resistance. The main goal of this study is to identify biomarkers that may aid in the early prediction of poor medical outcomes in cardiovascular patients treated with clopidogrel. This is the first time that a cutting-edge proteomic analysis is to become conducted in Caribbean Hispanic patients with cardiovascular diseases. Clopidogrel is an antiplatelet prescription drug commonly used to prevent cardiovascular complications. The resistance to this medication increases the risk of ischemic events in adults with coronary artery disease. To investigate the cause of this resistance to clopidogrel, we can combine different omics approaches so that more people get the treatment that they require. For the quantitative proteomic analysis, we use the tandem mass tag mass spectrometry method. Plasma samples were divided into groups, high PRU or resistant, and normal PRU or sensitive to clopidogrel. Both groups were compared with cardiovascular patients under other treatments. To expand our scope, we performed a second TNT-MS in which samples were divided by gender, clopidogrel response, and we used healthy subjects as controls. In Table 1, you can see an example of the protein expression changes by case comparison. POM1, alpha-1 antitrypsin, and antithrombin proteins were selected for further analysis. The abundance of the POM1 and alpha-1 antitrypsin proteins were validated by Western blot as shown in the densitometry graph. Previous studies demonstrate that POM1 activity can influence the risk of developing cardiovascular diseases. The Bioinformatic analysis of the differentially abundant proteins identified two interaction networks, the acute coronary syndrome and the acute myocardial infarction, represented in Figure 1. In the second TNT-MS, we identified proteins related to atherosclerosis and cardiovascular diseases, for example, coronary, ceruloplasmic, and carbonic anhydrase 1. This protein will be subjected to further bioinformatic analysis to identify them as potential biomarkers. In conclusion, the proteomic analysis demonstrates differences in protein abundance regarding clopidogrel responses. If you have any question about this presentation, please feel free to contact me and I will be more than happy to answer them. Thank you.